Sexual health, STDs and STIs. Americans ages 15 to 24 contract chlamydia and gonorrhea at 4 times the rate of the general population, and those in their early 20s have the highest reported cases of syphilis and HIV. STI versus STD. What's the difference between infection and disease? An infection is often the first step of a disease and occurs whether either bacteria, viruses, or microbes enter the body and start multiplying. The disruption of normal body functions or structure, especially when signs and symptoms appear, is considered a disease. Sex on campus. 1/4 of college students have an STD. The most common are HPV, chlamydia, and genital herpes. On the bottom, there is a pop quiz. It says, which of these college students has an STD? Well, that's a trick question. You can't simply tell by just looking at them. How many people are affected by or at risk for a sexually transmitted disease or sexually transmitted infection? The CDC estimates about 20 million new cases of gonorrhea, chlamydia, and syphilis. 1/2 of these infections occur in young people 15 to 24 years of age. Young people account for half of new STI cases, and only about 12% were tested for STIs last year. Undiagnosed STIs cause 24,000 women to be infertile each year. What are the types of sexually transmitted diseases and sexually transmitted infections? There are about 20 types of STIs and STDs, the most common being chlamydia, gonorrhea, genital herpes, HIV and AIDS, human papillomavirus, also known as HPV, syphilis, bacterial vaginosis, viral hepatitis, and Zika. There are 3 major types of STDs and STIs: bacterial, viral, and parasites. Bacterial STIs enter the body through skin contact or body fluids. A virus is introduced to your body instead of bacteria. So with the virus, a small infectious agent can only regenerate within living cells of an organism, and bacteria are living cells that cause infections.
How are STDs and STIs transmitted?
There are many ways how STDs and STIs can be transmitted. The first one is sexual transmission. This could be vaginal, anal, or oral sex. The second one is skin-to-skin contact. This could be kissing, non-penetrative sex, or body rubbing. The third one is body fluids. This means blood, semen, or vaginal secretions. Fourth, sharing of needles and other drug paraphernalia and needle stick injuries. The fifth one being from a pregnant woman to her unborn fetus or infants during vaginal delivery or through breast milk. And lastly, infestations. This includes scabies or pubic lice. Can be transmitted through the shared clothing, bedding, or linens. Many people who have an STI do not develop any symptoms and may not be aware that they have an infection that can be passed to their sexual partners. This is why checkups are so important. Generally, the symptoms include unusual discharge from the penis, vagina, or anus, pain during urination, sores, blisters, ulcers, warts or rashes in the genital area, pain in the scrotum or testicles, lumps and bumps on the genitals, or pain during sexual intercourse. One should get tested and have regular checkups with a healthcare provider who can help assess and manage risk, answer questions, and diagnose and treat an STD and STI if needed. Laboratory tests can identify the cause and detect co-infections that one might have contracted. Some of these tests include blood tests, urine samples, and fluid samples. Can STDs and STIs be treated?
Bacterial STIs are often cured with the use of antibiotics. Although it does not prevent the disease from ever coming back, it can remove the infection after treatment. And with viral STDs, there are no cures. The treatment was only diminished by the symptoms.
How to reduce the risk of getting an STI? First, know your sexual partners and their limits. Your partner's sexual history is as important as your own. The more partners you or your partners have, the higher you're at risk of getting an STI. 2. Use a latex condom. Using a latex condom every time you have vaginal, oral, or anal sex decreases the chances of infection. Condoms lubricated with spermicides do not offer extra protection. Frequent use of some spermicides can increase the risk of HIV. 3. Avoid risky sex practices. Sexual acts that tear or break the skin carry a higher risk of STIs. Even small cuts that do not bleed let germs pass back and forth. Anal sex poses high risk because tissues in the rectum tear easily. Body fluids can carry STIs. Having any unprotected sexual contact with an infected person poses a high risk of getting an STI. And lastly, get immunized. Vaccinations are available that will help prevent hepatitis B and some types of HPV.
GYT. Get yourself tested!
GYT is a social movement to encourage young people to get tested and treated for STDs and HIV. This campaign is a partnership between the American College Health Association, Kaiser Family Foundation, National Coalition of STD Directors, MTV, and Planned Parenthood Federation of America.